Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio Show on Power 96.5 and 1080 AM WUFO. My name is Francesca Messiah. I am the manager of workforce development here at Kaleida Health. And I want to thank you for if you're a regular listener, I want to thank you for listening. We appreciate your support. And if you're a new listener, I want to say welcome and you won't be disappointed. Thank you. Kaleida Health, I always give a little intro about Kaleida Health. And besides being Western New York's largest healthcare system, besides our hospitals being Buffalo General Hospital, Gates Vascular Institute, Oishei Children's Hospital, which will have a name change, I believe, in January. So that's Oishei Children's Hospital. Visiting Nursing Association, the VNA. 24 Hours Healthcare. Millard Fillmore Suburban. Also, we have this hospital. We have DeGraff Long-Term Care Facility, as well as High Point. Both have long-term care, rehab care, but it's great care for you and your family. And also at DeGraff, there is an urgent care center, an emergent care center. And again, that is in North Tonawanda, which is Erie County. Well, I just wanted to say a little more about Kaleida Health. And we know they're the hospitals. We know they take care. I know they do a great job taking care of all ages. But also, I just want to share with you that Kaleida Health does not discriminate, exclude, or treat people differently because of race, color, religion, sex, national origin, disability, sexual orientation, gender identity or expression, physical appearance, and source of payment or age. So I just wanted to make sure that you knew if ever you were wondering, oh, I have a family member or myself, they know. So again, uh, please come to Kaleida. Please come to one of our facilities because we do not discriminate. And I will read that again on another show because our show today is very exciting. For those of you who are regular listeners or you've been listening over the years, you always hear me talk about eating, the importance of eating healthy. Can food be medicine, or can food hospitalize you or do or things to you? So today's topic is healthy eating with the season. That season is fall. And you may say, hey, yeah, healthy eating with seasonal foods. But you know what? Today we're focusing on a budget. Healthy eating with the season on a budget. And our guest for today is no stranger to our program, and that is Kelly Cardamone, the rock star of healthy eating. Good morning, Kelly. How are you?
Good morning, Francesca. I am doing very well. Happy fall, and thank you for having me.
Oh, you're welcome, Kelly. Kelly she has a master's of science. She's a registered dietitian, a licensed dietitian, a clinical dietitian, clinical dietitian education. Does that E stand for education?
So it's certified diabetes care and education specialist.
Diabetes care. And we'll be talking a little bit today about diabetes, but we will have a show dedicated to diabetes. And IFNPC, what does that stand for? Your initials?
So I am board certified in integrative and functional nutrition.
Thank you. And also and something with to do with exercise as well, I believe.
Yes, I have my first degree exercise physiology. So I actually am a certified exercise physiologist as well.
Yes. So that's why we have Kelly, because she really knows her stuff. She knows what she's talking about. Kelly is also the clinical nutrition and diabetes program manager at General Physicians. General Physicians is part of Kaleida, and they have primary care, uh, all types of counselors. So they have a lot of different things in the area of healthcare. So Kelly, I just want to say welcome back to the Great Lakes Health Radio program.
Thank you. Always my pleasure.
Yeah. So as we jump right into it, what does it mean to eat healthy with the season?
So it's a term that really encompasses quite a bit, and it means to eat produce, things that are like fruits and vegetables that naturally grow in the region where you live during the current time of year. It means to eat seasonally. And so, what that means really, or why we do that, I should say, is for instance, I'll give you an example. So, in the summer, or let's even say May into June, you'll start seeing asparagus. And then we get into strawberry season, followed by blueberries. And so it's kind of following and trying to eat the fruits and vegetables as they come in season, but really where you live. And here's why. One is when you have these fruits and vegetables available and they pick them at peak ripeness, meaning they allow them to ripen naturally on their own. And why that's really important is because it can raise the antioxidant level and the nutrient content of those foods. So, talking as food is medicine, that's a perfect example of really letting that fruit or vegetable mature to where it's going to be the most benefit. A lot of times, so these fruits and vegetables will be healthier. They taste better. You'll find that they have a more intense flavor, and they also can be more affordable because they are local, meaning they don't have to travel as far. So it can also be better for the environment, and it's also supporting your local farmers. And they do tend to be less expensive.
And that's great. I know that sometimes, like in the middle of winter, tomatoes just don't taste the same.
No,
You
no,
know,
yeah, I agree with you. No.
fresh tomatoes versus one that isn't right for fresh. And I just have to add, this year I've been growing green peppers. I went to a celebration this summer for a woman by the name of Gail Wells, who was a powerhouse in the area of food and nutrition and planting trees. And they gave me a plant. I've never planted anything, any kind of fruit, but I now have many green peppers. And
Awesome.
and I never know when they're really healthy. I just gotta pluck them, and talk to them. But it's if you've never grown fruit or vegetables before, it is so exciting and so rewarding for when they start blooming, and then you're able to pick them and eat them. So I just had to add that. Why is this topic popular now in terms of eating healthy? With the season, I have I have answers, but you're the expert.
I would say there's many. It's multifactorial. Part of it is, well, food costs are they're quite high, and we talked about, so cost can be part of it, but there's a big movement where it's food as medicine, and I really think that through education and through just grassroots efforts, I think we're really spreading that message more to people. I think we are finding that people really are taking an interest in their health. I'm finding that when I'm talking to farmers or those that, have even like local stores where they're selling fruits and vegetables, that they're saying over across the board that there is this consensus of they're seeing more of an interest in everyone. They're having an interest in their own health through these, by eating healthier. The other thing is that environmental impact. And I think that environmental issues and concerns have come to the forefront as well. And that's where I said it's multifactorial. So I think it hits home on many levels.
Hmm. Yeah, thank you. At this, at what age should our listeners think about eating healthy?
If you, how about this, for anyone, I have pregnant moms, I tell them you want to start when you're pregnant, like meaning what you eat while you're pregnant. It starts that early, Francesca. Like what you're eating at that point in time is going to impact even the growth of that baby. You are never too young to start eating healthy. And I think, unfortunately, a lot of times we think, well, kids are picky eaters and they won't, eat these fruits and vegetables. And I think I've shared on other shows, my children eat lentil burgers and turkey burgers and tons of vegetables because it's what we fed them since they were young. And it's never too early it's never too late or too early to start. Even if you are in your 70s or 80s and you are listening and thinking, why bother? You should. It helps to improve quality of life when we can improve our health. So I don't think there's ever, I'll say, a time where that it's too early to start or too late to start.
Yeah, and like I said, we'll do a show on diabetes in another few months, where we will dive into that topic. So if you have a garden, or you just had fresh, or going to a farmer's market, or even the grocery store, um, when can the listener begin? When can our listeners begin freezing? And what's the process? Is it a simple process? Like, what do you need to? I'm thinking of myself. What do I need to start freezing these fresh green peppers?
Yeah. So there are a few things I will share with you. I know we're talking about fall right now, but as I had mentioned this summer, I was making buckwheat pancakes for my kids, and I pulled out fresh blueberries that we picked over the summer. So you really take advantage of all times of the year for preserving the fruits and vegetables. Some are going to be easier than others, but let's talk about fall right now. So how do you freeze? Couple of things is the best way for, like, right now we've got broccoli that's in season, you've got cauliflower that's in season, and squash, and we can talk more about that in a little bit. But you've got these wonderful vegetables and fruits. We've got apple season right now. We just went apple picking the other day. So to freeze it, the best way is, a lot of them, like for instance, your peppers or broccoli, you do want to blanch them. So that is putting them, so you want to cut them up into larger pieces, not too small. You want to actually put them in boiling water for about 3 minutes. For some, you might have to go up to 5 minutes if it's a little bit of a denser, vegetable. But you blanch it, and then you have to take it out. So you put it in quickly. You got to set the timer in the boiling water. You pull it out. You have to throw it really into an ice bath. So water and ice. You have to let it cool, and then you pull it out and let it dry out. So you want to get all that moisture off of there, because that's actually where the bacteria can grow in the freezer. So once it is completely dried off, you may have to pat it dry. You then can put it in, I use freezer bags. You also can use jars if you wanted to, like mason jars. But for me, I like to take up less space in my freezer. And then you put them in the freezer. Now, with that being said, I'll give you an example. I did this with blueberries. First, let's just throw out an example. I put the blueberries on a flat sheet, and I froze them individually, and then I put them in a bag, because if I have something that's wet and I just throw it in the freezer and there's some moisture, things will get stuck together. So you may want to lay out what you have on individual, pieces, and let it, put it in the freezer for a couple hours and then store it in a bag. You want a freezer bag, a freezer safe bag, and make sure you put what it is. And I always put the date on mine, so I know that, 6 months or by a year. They'll usually say 6 months, but a lot of my stuff, if it's in a deep freezer, I'll use it within the year. And then you store it that way. Right now, you've got apples. Steam up the apples, add some cinnamon if you want to, make applesauce. You can make your own applesauce, and you don't need fancy equipment. Keep that in freezer bags. Take your squash. Now, the squash, you do want to, before you blanch anything, by the way, you do want to peel it and take out the seeds before you do that. But you can do large pieces of squash and freeze that. But I actually take my squash, I mix, like puree it essentially. And then I will actually freeze the squash that way, and pull it out as needed. So there's a lot that you can do, and that you can put in the freezer.
And let me ask you with the apples. You said you steam the apples. You cut the apple. Do you cut it up first?
Yep. So I do want to, you want to take the core out. So you want to core the apple. I leave the skins on. And the best thing, I know people worry about pesticides, and, if you're not buying organic, and a lot of the local farmers are not necessarily going to be certified organic, and that's okay. But I take the apples, it's the friction on the outside. So rinse it, take like a paper towel or towel and just rub it, you'll get a lot of the, any of the pesticides and stuff off. I take the core out and then I chop mine up. You can just chop it in halves or fourths. I put it in a pot with just a little bit of water. And once they get fork tender, and then I'll add some cinnamon and I'll even just mash it up with a fork or an immersion blender. And then you can put it in jars and put it in the freezer, or you can also, as I said, put it in bags so it lays flat and it doesn't take up a lot of freezer space.
Yeah, and cinnamon, and put some raisins in there.
Yeah,
Maybe
nutmeg.
walnuts.
Yeah.
Yeah. Oh, that sounds delicious. And I just had you say that twice, so hopefully our listeners are able to at least copy a few things down.
Yeah.
At least. Yeah. How about so what foods, so okay, so apples are fall. Apples, cauliflower, broccoli, squash. What's the next season?
Yeah.
Well, yeah. Like, you know what? Before we even talk about next season, so as we talk about eating healthier, freeze some things, the process. How about for a football party? What's something and anything in there that you've mentioned that we can make a little healthier to to uh to go with our nacho chips or our pita bread?
Sure. So this time of year, right, it's football season
That's
and
right. Go
it's
Bills.
football season. Go Bills.
All
So
right.
to keep it healthy, um, a lot, and it is a common question I get from patients as I'm going to a party and I say to them, if you don't know what's going to be there, bring your own, bring an appetizer. So a couple of things we can do to keep things healthy. I know we're in Buffalo and we love our chicken wings. So a couple of things. One, you can make them in the air fryer. You can also bake them. And if, again, the skin is what makes the chicken wings really tasty, that's the fattiest part. But you can take like chicken strips, like even just chicken breast strips, and use your favorite sauce for that. And that would give it that kind of, buffalo sauce, whatever you're using for that. So you can do that as well. But you can also, when you make a dip, instead of using sour cream, use non fat Greek yogurt when you're making a dip. You'll get some protein in there, some good probiotics, and actually you'll get a lot less fat and it still has that same consistency as sour cream. The other thing is, I love taco dip and taco salad this time of year. So instead of using beef, a lot of times you can do one that's meatless. So you can just do beans if you want to. But the other thing you can do is to do ground turkey and ground chicken that's really lean. So using 90, 95, 98% lean and draining any of the fat and using that as a healthier option as well. And instead of using, and if you're going to use chips, buy corn chips, but buy multi-grain chips, multi-grain
Mhm.
crackers. So things that are a little healthier.
Or if you're like me, I don't like salt. So, but sometimes it can be a challenge finding salt-free products.
Yeah.
Like salt-free chips. It could be, and I also want to say if when you're making your appetizer, and if you're making it with a Greek yogurt, or if you're making something, don't tell your friends. Don't tell
Yes.
your friends what it is, because your friends will automatically say, "Ew," and they haven't even tasted it. So, so that's what someone told me once. So that's just, don't tell your friends. Let them tell you how good it is, and then you just take the smile and take the bow.
They won't even know. If you use lean turkey, like you said, you by the time you add seasoning to things, Fran, you're absolutely right. People won't know. And so I think it's that mind game of if you tell them ahead of time. So I agree with you. Don't say anything.
Right,
Just
just
bring it.
so right, exactly. So we're it's fall, and so some foods that have been out for a few months. What are some of the, like, what would be some of the next round of fresh fruits and vegetables that we can begin to look at and think about, freezing them and blanching them, freezing them, storing them. What's around the corner?
Yeah. really great question because, right, we're trying to prepare. And so I'm going to give you, I know we talked about broccoli and cauliflower, but I'm going to throw out a few more. And some of these are most active up through the end of October, even into November. But green beans and yellow beans, pole beans, beets, Brussels sprouts, carrots, collard greens, kale this time of year. It's my favorite, one of my favorites. Things like I know we mentioned potatoes and pumpkins, but your winter squash, your butternut, your acorn. And of course, we said our apples and our peaches. You'll also have some grapes this time of year. So the thing to remember is too, what's really nice about root vegetables, even turnips, when you're looking at those harder, denser vegetables, potatoes, they'll last longer and store longer. Keep them in cold storage. Now, you may not have a basement. Some things you can keep in a fridge, but think about it, it's going to take up space. But if you put them in a container or even like using some of those coolers that you would bring to someone's house, you can store stuff in there. But if you have a wall, so if you have a spot in your house, like a room or a closet where that outside wall, I know that happens in most homes, especially your older homes, they're colder. Store your stuff there because the cooler temperatures will keep them longer. We store everything in our basement, the unfinished part of the basement. It's cooler. So we put a lot of stuff down there.
Yeah, no, and that's great because I know the other day because I don't have any gas in the garage. I don't have, I barely have the car in there. But the other day I put something in the garage and then I thought about it. I said, are there chemicals? No. Are there fumes? No. And I just kind of did this mental checklist and
Yeah.
I just needed to put it and I put, laid something on top of a storage box,
Yeah.
because it's a little cooler. It wasn't in the sun. So you're
Yeah.
absolutely uh, uh, correct. Are there some internet sites that are better to go to? I'm thinking if someone's listening to the show and saying, "Wow, that motivated me. I'm inspired." Where would they
Abs-
find out additional information?
yeah. So I'll give you a couple. There's quite a few websites, but I will share the one where I got where everything was in season. If you actually, so I'll just throw this out, like to tell you what's in season when, and they have some good
Yes.
tips. There's two things. Believe it or not, if you go to the Farmer's Almanac online, they
Oh,
actually will give you some good tips with regards to produce in certain times of the year. But I went to a website. It's if you literally just put in New York Harvest Calendar dash pickyourown.org, that gives you what's up to date and in season. If you're looking for some recipes, some easy ones to remember, eatingwell.com. So eatingwell.com. I always like skinnytaste.com. Many different, you can pick there's so many things you can choose from with regards to diet. Am I on a diabetic diet, a renal friendly diet, heart healthy, low carb? So Skinny Taste, SKINNYTASTE.com. You also can go to heart.org. That's the American Heart Association. Lots of fantastic recipes. HEART.org. That's another great website. There's quite a few. There's also like realfooddietitians.com. But those first three, you'll find a lot of great recipes there that are healthy.
yeah, no, thank you. Because I know we're eating healthy, but we also then have to think about you can't add all the different things. As my cousin Gilda rest in peace used to always tell me, you take all the fun out of food. I didn't take the fun out, but I was just maybe not add everything to it. And like you said, people never really they for the most part didn't know the difference. Anything else you would like to add that we haven't covered?
You know what? The biggest thing is just to remember that, and this theme follows through, I think, with most of the shows we've done. You have to embrace eating healthy, excuse me, as a lifestyle. And just like you just mentioned, you take the fun out of food is, and truly it's not true. We're changing a mindset that food is medicine, but you can make things taste really great if you take out the salt, you take out the fat, you add herbs and spices. And there are ways that you can make your food so flavorful and healthy. And it really becomes, food is medicine. So it's really shifting your mindset on the food and viewing your food in a different way. It doesn't mean you can't enjoy it just because you're making healthier choices, but really take advantage of the fall weather and all of the wonderful produce we have, because it's fantastic right now.
Yeah, no, that's great because even for lunch, if you're that's a another way of eating healthier is just changing what you eat for lunch.
Yeah.
You know, um, I had to buy this year. I bought an insulated bag, and if it's really and when I even when I travel, sometimes I'll just put an ice block in there. If I need to keep something healthy, like if I want fresh fruit, I just cut it up, put a healthy block, put one of those healthy block, an ice block, and then drive to, New York or Rochester, Syracuse, because when I get there, when I arrive, if it's at a hotel or visiting friends, I have some of my own food.
Yeah. It's just prepping, preparation, prepping ahead of time.
And applesauce is apple/applesauce. And one last question. I know we only have a couple minutes left. Where do you go apple picking?
So I have to tell you one of my favorites, and this is only a shout out to if you've ever seen Farmers and Artisans, which is on
Yes.
Main Street and stuff. Okay, so I
Yes.
love Julie there. So I know her family owns the farm. We go to Blackman Farms, and it's near Lockport. And actually, we even went when we lived in the city, and now we've moved outside of the city. We still go. It's that we just picked right now. It was McCowan and McIntosh and Cortland, and there were pears, and you can pick pumpkins. And it's we do it every year with our children. We've done it probably about 10 years. It's a family activity we do that just is like how we celebrate the start of fall. And we picked 35 pounds of apples. And we'll store them, we'll use them to make things, we give them away, and it's less expensive too when you a lot of times can go pick your own fruits and vegetables. So yeah, that's where
Oh, it's
we go.
definitely, yes,
Yeah,
it's definitely less expensive.
yeah, yeah.
Yeah.
And it's so amazing to pick. My kids even love it. You pick the apple off the tree and then you're eating it. I don't know. It just tastes better
You
when
know
you
what?
do it.
And I always see little kids eating. I see the other day I was at the hospital. I was watching this little boy enjoying an apple. I have to admit, I brought an apple for lunch that day. I had to go in my bag and eat it because I noticed, I don't know why, I have little cousins who love apples. Little kids love apples. And I said, you know what? I need to find that same, adopt that same love of apples. But on that note, Kelly, this is not the last time that you will be a guest because we haven't talked about diabetes in a long time. And as we go into the true holiday season for all ethnic groups, there's a lot of food that's there. So we want to make sure that you keep your diabetes in check. And on that note, I want to thank you, Kelly Cardamone, the Clinical Nutrition and Diabetes Program Manager at General Physicians. I want to thank you again for being our guest this morning as we talked about healthy eating as a lifestyle, fall season. And thank you. Thank you, Kelly.
Thank you for having me as always.
You're welcome. And listeners, don't change the dial. In less than 30 seconds will be part 2 of the Great Lakes Health Program with Kaleida Health, Francesca Messiah. And now on to part 2. Good morning, good morning, good morning. And I hope you enjoyed the first half of our program. Well, today, you know what? We're talking about something we talk about, right? It's part of conversations. And I don't know if I know people are listening, but it's something that we really have to start taking seriously. And I mean, the entire community. And that's cancer. We know, everyone knows somebody, all listeners. I'm going to say 99.9% of us know somebody who has had cancer. So today we're talking about cancer screenings and prevention because we don't know if that loved one has made it or not. But today I just thought, I know there are a lot of different cancer months. This month is can't, but cancer lives with us every single month. So that's why our guest for today is Dr. Schweitzberg. And Dr. Schweitzberg is a friend. Been working with him for years in this area. And Dr. Schweitzberg is the SUNY State University of New York Distinguished Service Professor, Professor and Chairman of the Professor of the Biomedical Informatics Department of Surgery at the Jacobs School of Medicine, UB Med School, and Biomedical Science. That's quite a title that I know he wears his title well. Dr. Schweitzberg, you are a distinguished, first of all, I want to welcome you to the program this morning. How are you?
I'm terrific, Francesca. Thank you for the invitation.
Oh, you're welcome. I'm so happy you could make it. Now, you are a distinguished service professor. How did you get to the goal? I want people to hear just a little bit about how you have gotten a distinguished service professor. What does that mean?
Well, it starts by, the academic pathway to become a physician and a surgeon and a professor is a journey. It's a 20-year or more journey. If you think about, the role, you go to 4 years of college and 4 years of medical school. I did 5 years of surgical training, so that's 13, 2 fellowships, that makes 15. And then I started my career at Tufts University in Boston as an assistant professor. And for people on the academic trail, we do research, we write papers, we teach medical students and train the next generation. And then you become an associate professor and you keep doing more and more. And I left Tufts and went to Harvard, where I became professor of surgery before coming here. And here at Buffalo, where I was appointed professor and chair for the Department of Surgery, we did many years of work and service doing cancer screening and social justice and health equity work and innovation and work to the profession, and was nominated by Michael Caine when he was the dean to be reviewed at SUNY, which is 62 colleges and universities, to be considered and appointed a SUNY distinguished professor. So it's not an overnight thing. It's probably a 30-year journey.
And that's wonderful. And I also want to say to our listeners, you probably have seen Dr. Schweitzberg at a community event. You might see him grocery shopping at Wegmans. So he is part of the community. He's not only working in oncology and cancer. You probably have seen him at an event. You may even see him at one of our plays. We have a great play taking place right now in Buffalo. So I just wanted to share that with our listeners. How long have you been working in the area of cancer and oncology?
Well, I've been, after my training, a surgeon for 38 or 9 years. And I've been doing cancer surgery since then with different focuses. The whole treatment of cancer has become more and more specialized, but throughout the course of my career, I've taken care of pancreatic cancer and colon cancer and gastric cancer, and have focused a little bit more in the last couple of years on thyroid cancer. I am the chair of the Kaleida Health Cancer Accreditation Committee. So I am concerned with quality improvement, care of patients, cancer prevention, cancer screening. And so this has been part of my career for nearly 40 years.
Thank you. And so I know you have seen you've seen treatments come a long way in terms of the medication. I have a friend now with stage 4. Breast cancer came back, but she's doing great, you know? So that's why we have this show today. How important are cancer screenings?
Cancer screening is the gateway to diagnosis, and that is the gateway to treatment. And I can't overemphasize how we need to get behind this in our communities, in our families, in our friends. Many cancers have no symptoms. And science is amazing, and you alluded to the fact that people are doing better than ever before. When I finished my training, having stage 4 cancer was 6 months to live or less. Now, for many patients, they can be cured. And so the goal isn't to cure people with chemotherapy. The goal is to find these cancers early, because the earlier we find a cancer, the less invasive the therapy is, the possibility that you won't need radiation or chemotherapy because your cancer can be cured. And, the truth of the matter is, our populations of people who have problems getting access to screening present with later stage cancer.
Yes. You know what? This topic is emotional, so I just have to sometimes get a grip on myself. What age should persons over 18, or I guess my question is, what age do you begin screening? And I just say 18. I'm thinking about if you're coming to apply for a job here at Kaleida, you have to be 18. So that's where I got the number 18 from. So I don't know if 18 is the correct number. I'm just guessing. But what age should people begin screenings for cancer?
A lot of it depends on, family history. Yet, and nobody would advocate for routine screening at 18 in the vast majority of people. But we know there are childhood cancers, and we hear these tragedies, but those aren't screening failures. Those are just bad diseases. And one of the things that we've seen over the years is an increasing number of people in their 20s and 30s with colon cancer or breast cancer, not so much prostate, ovarian cancer in their 30s. And so we need a couple of things. We need people to understand that the genetics of their family history is important, and that genetic screening in certain families is critical. Breast cancer is a good example. If your mother or your aunt had breast cancer, then screening not just for breast cancer, but for the genes that cause breast cancer become critical. I have a family friend who he himself had prostate cancer. His wife just had breast cancer. And, they were very concerned for their daughter, who is in her 20s. So it doesn't sound like much of a cancer age. They did the genetic screens on her, not a mammogram, but the genetic screening is part of screening. And she's at an 87% risk of having breast cancer in her immediate future, and made a decision to have mastectomies in her 20s to prevent that breast cancer risk. So it's the cancer screening, but also in some cases, the genetic screening in those people whose families have a strong history.
Yes. And how do you begin the conversation? Because, not all families are going to talk about cancer. Sometimes people don't know how they passed away. What's a way to, do you have any recommendations on how to begin a conversation, or when should this conversation begin? Should it begin earlier, in your teens? Should it begin in your 20s? About what did mom had, grandma, auntie, dad?
I think it's hard to have that conversation with an 8-year-old, but your point, Francesca, is really well taken. You want to learn about your families before we lose them. And so much family knowledge and wisdom is lost if we don't ask the questions. As a teenager, we're often not smart enough to go, what should we do? So it's up to us as parents to inform our children about what happened to their relatives. So I don't think, teenagers is too early to tell the family history of what has happened in their family. That's a good time to start.
Yeah. And you know what? I'm going to have you name the cancers that you have said are you're seeing in the people in their 20s and 30s and 40s. I just want to make sure our listeners got that.
Well, sure. We're seeing colon cancer in early age groups, which is why screening recommendation for colon cancer has moved down traditionally from 50 into lower numbers if there's a family history of colon cancer and related cancers. We're certainly seeing more breast cancer in younger women, and so asking the questions about related history. Many young women have breasts that are too dense for mammograms, so there's other modalities like ultrasound or MRI. So we're seeing that. In our own friend group, we've watched people leave too early, young women in her 30s dying of ovarian cancer. And the question is, could any of this been prevented if they'd had genetic screening and knew she was at risk? Those are the probably the most important ones. We don't see that much gastric cancer. Thyroid cancer is much more slowly growing, and so we have time to make those diagnoses. If you feel a lump in your neck, you should see your doctor, and often the first step is an ultrasound, something like that. But ovarian, breast, and colon, I think, are probably amongst the big three.
Mm-hmm. And speaking of feeling a lump in your throat, I know of someone who recently was diagnosed with cancer of the saliva glands.
Sure.
So it can. Okay, I'm going to come back to that question because so is there data that indicates certain screenings should be taken, I don't know, a little more seriously for people of color? And if they are, and if yes, what does the data show in terms of what demographics, race are getting some of the cancers that you've been talking about?
Well, prostate cancer comes to mind in our communities. The Department of Urology has been, aggressive in trying to get into the communities, but, we should recognize that there is sometimes a sense of mistrust in underserved populations, but we need to be aggressive in delivering the message that we care about you, and the only way to make a diagnosis is to screen. So prostate cancer is one. Men over 55, and there are particular risk factors: people with reflux, people with obesity, people with a family history. And one of the odd ones that we're focused on are first responders and firefighters have a 62% increased risk of esophageal cancer. So we've been on, different programs and TV talking about risk factors for esophageal cancer because it's very lethal. But if it can be diagnosed early and even in the pre-cancer stage, we can save lives and prevent deaths. So there are ways to identify patients at risk. I want to reach out to all the first responders. If you have reflux and have been a firefighter and you're over 55, please reach out to us because we can arrange for screening to see if you have any of the cells in your esophagus that are at risk for cancer. Colon cancer, nobody wants a colonoscopy. Actually, nobody wants the prep. The colonoscopy itself is not so bad.
I was going to say, because I had one and I felt great after.
Right.
I felt clean.
Yeah. No, but people talk about the prep and the colonoscopy, you get sedated. I don't even remember mine. But, we're coming up with new modalities of looking for cancer cells in the stool, and there are ways, but it's important to be screened. So we're all procrastinators. I did not have my colonoscopy till I was 52, and I brooded over it, thinking, oh my goodness, I've waited. I've missed my chance to be timely. My colonoscopy was clean, but in the bed next to me was a woman who gave herself a colonoscopy as a birthday present for her 50th birthday.
Oh,
And by coincidence, she was in my clinic a week later because her test was positive.
oh,
And so we need to be proactive. These are preventable deaths. And the truth of the matter is the most disadvantaged people present in later stages because they are mistrustful of the need to get screened. And we somehow need to break down the barriers. And if you want to be businesslike about it, it's actually less expensive to take care of an early cancer than to wait till it's spread all over the body. So it's not just good care, it's not just good community, it's not just good conscience, it's good business as well. Because for many people, if they're not working, they're not eating, they're not paying rent, and our ability to cure your cancer as a polyp is a day in and out of the hospital, and you can go back about your business the next day versus perhaps being out for the rest of your life and not being able to take care of your family or yourself.
yes, or yourself. Any others? So we have prostate cancer, esophageal, colon. Any others that show higher risks in people of color?
Well, breast cancer is another one, and because it's really about access to screening.
Yes.
And getting an initial mammogram, not putting it off, either taking advantage of mobile screening. Some programs have mobile screening, but screening and mammography is the gateway to the diagnosis. And we need to continue to lower the barriers to screening, because in the state of New York, if you have cancer and have no resource, there are finances available from the state to make sure that all cancer patients are taken care of.
Mm-hmm. And again, screening so we can catch it earlier.
The earlier you catch a cancer, the less invasive the treatment is, and the earlier people can be returned to their quality of life.
Mm-hmm. So that's breast. Any others? We have prostate, esophageal, colon, breast cancer. Any others?
Sure. For women, making sure that they are with their primary care doctor or their gynecologist so that they're on the appropriate screening schedule for pap smears. Now, we used to pap smear everybody every year. We found out that that's not quite necessary. You'd have to interview my wife. She's the gynecologist.
Yes.
But still, there's a need to screen. You need to have educated, and this is not my area of expertise, educated discussions about HPV vaccine, because
yes.
these are preventable. Again, not varying symptoms, so that at least an ultrasound could be performed or a physical examination. So these are incredibly important. And the same genes that put people at risk for breast cancer put them at risk for ovarian cancer.
And they don't say enough about that. And I'm not a medical professional, so sometimes I get, well, how do you know that, Fran? Just probably because I had some, I've known people with ovarian cancer, and that's how I found out about breast cancer. But so it's like, don't ask me, ask your primary care physician or oncologist.
But we need to have proactive patients, Fran. So the most common group of women to get gallbladders are women in their 40s who have had children. And yet in the old days when we used to make incisions, it was routine to reach down and feel the ovaries and see if there's anything abnormal. Now that we're pointing laparoscopes, towards the liver, I still turn the laparoscope around and take one last look at the ovaries in any of my women patients in those age groups, because you never know that if you simply look what you might find. And I will tell you, simply by being proactive, I have diagnosed an ovarian cancer that would have been asymptomatic, undiagnosed until it would have been potentially terrible. And so I will tell you, if you're waiting for your gallbladder to be taken out, you should tell your doctor, please turn the scope around and take a quick peek at my ovaries and make sure I'm okay, because it costs nothing and it takes less than a minute.
And as I say, this program is about education and is about education, educating our community, educating all of us. And that is a good educational point because I'm sure there's nowhere that says to tell your physician or to ask your physician to turn the scope around. So that is just that's a good tip.
Maybe that
Um,
will be our slogan, turn the scope around for 1 minute.
turn the scope around and I think I also wrote something down already. One of your quotes: "Screenings are something about are a gateway to diagnosis." So I've been writing some of the things you've been some of your quotes today this morning. Yeah.
And,
So
and for your listeners, what Fran was alluding to, I literally run into her everywhere, and it isn't even near my neighborhood. I could be out, 10 miles from my house, and there's Francesca walking into the Verizon store. It's like Francesca is literally everywhere in the community.
I love the community. I love our community, all of our community. I love Western New York. So yeah, thank you. And in your opinion, so what are some of the things I'm not gonna is what are some of the reasons why people shy away from screening and what's your advice for people who are afraid? I mean, some people make an appointment and they're ready to go that day and then they cancel. Even if the sign says there's a $50 cancellation fee. Why do you think people shy away? And what's your advice?
You know, without being too metaphysical about it, God helps those who will help themselves. And this
Mm,
is part of self-help. This is part of self-care. And it is really hard. Many of us are busy. Many of us are worried about taking a day off of work.
right.
And maybe you should have a me day where you see your doctor and you get your colonoscopy and you arrange your mammogram. And we could be more efficient about preventative, you know, care times. But if you don't look, you don't find. And for people who don't want a colonoscopy, then some of these alternatives like Cologuard or FIT testing might be viable. But if it's positive, then your colonoscopy will have value. The same way that we do the esophageal screen, it takes a
Mhm.
minute. If the test is positive, then we'll do an endoscopy. But you have to be there for your loved ones. There are certainly any number of tragedies of busy people, including physicians who make, I'll just say it out there publicly. We make the worst patients, by the way.
Mhm.
Uh, and it's true. And I would put myself in that and I try to be a better patient. But we need to make time for ourselves. We need to prioritize the fact that people will care about us if we leave this planet prematurely. And we should not just do it for ourselves, but do it for our friends and family.
Yeah, thank you. That's so true because I like that a me day. And if you don't have, let's say you've almost used up all of your sick time, your PTO time, whatever they call it on your where you work. Um, ask the scheduler, the person scheduling your screening for a morning appointment, or if you have to pick your children or grandchildren, foster children up from the bus stop. Ask them for their first available appointment. Ask them what time do they start, and then ask them for their first available appointment because you can ask that question. You don't have to take the appointment someone gives you, take the appointment that works around your schedule so you can make the most out of your me day slash your me time because the screenings are key. They are the key, they're one of the keys to life, and we want all of our listeners and their family, extended family, we want them to live as long and have a quality of life as they can.
And part of the, philosophic thing one needs to wrap their heads around, you actually have to screen a fair number of people to find one.
Hmm.
And so you say, well, in a colonoscopy, the chances are about 1 in 100 you're going to have a cancer. Well, you go, well, that's not going to be me. But that means it's not zero, it's one. And the same people, somebody's going to win the lottery, somebody's going to have a colon cancer. And so, some people say, well, you got to screen so many people. Where's the value? The value is in preserving life. And people need to understand that screening is the only way to diagnose cancer, because when it presents with symptoms, that means it's presenting late.
And as you opened your statement, is that many times you don't even know you have the symptoms. There are no symptoms until you get screened. But but like you said, every 1 in 100 person. So just because you, I just can't say enough about screenings, because I've seen, great results of people have gotten screened, and then others, who aren't as lucky. But cancer treatments have come a long way. Um, Dr. Schweitzer, we have 3 minutes left. What is it? What are some of the most important things, some important tips you would like to leave with our listeners? Oh, number one, how to contact you, or contact what office should they contact if they're interested in following up on screenings?
Well, from a Department of Surgery point of view, we have a UBMD website. We're not hard to find, so you can just look us up on Google at UBMD Surgery, and you can be directed to the right place. We have resources within all of our major hospitals in the city. I personally work at Buffalo General, and our teams work at Buffalo General and Oshai and the VA and ECMC and Millard Fillmore Suburban, but there's other good hospitals in the city. But people can, get on our website, and if they have a question, use our contact page, and we'd be happy to direct people to the right place. We want to treat your concerns as if they're personal emergencies. Though many cancers are slowly growing, a breast lump will not be worse tomorrow, but it's a personal emergency. It raises questions. There's fears about life and family and children. And, if you're a 40-year-old woman and your kids are probably just teenagers, you have cares. So we want to get you in and reassure you, or take it head on as efficiently as possible. Don't miss your colonoscopy appointment. You can look on our webpage. We've got plenty of access between our colorectal surgeons and our GI colleagues. We have plenty of ways to do this. If you feel a lump in your neck, go to your primary care doctor, get an ultrasound. There are so many ways to do it, but you can reach us personally by going to our UBMD surgery website.
And for our listeners, I have to say, if you're coming in at the end, this program you can find this program on the Kaleida Health website, or just Google Kaleida Health, Great Lakes Health Radio, or just Google, or any of your search engines, Great Lakes Health Radio, Kaleida Health. But I know for a fact that this program will air again, because this information is timeless, and this information is priceless. So this is information that all of us need. And can I ask you back for maybe another show, Dr. Schweitzer, where we can go into detail on some of these cancers that you've mentioned: prostate, esophageal, colon, breast, pap? Can I invite you back?
Of course, and I can also put you in touch with the true experts of each disease process.
Okay, that sounds like a plan. I like that. Well, listeners, I want to thank our guest today, Dr. Steven Schweitzer from oh gosh, there's so many titles: SUNY Distinguished Service Professor, and he's also in charge of the Kaleida Health Cancer Accreditation Foundation. But I want to thank you for being our guest. And listeners, in 2 weeks, you'll hear, next week, you'll hear from my colleague at ECMC, Cindy Bass. And until then, be safe, be well, stay healthy. See you next time. I'm Francesca Messiah, Manager, Workforce Development at Kaleida Health. Bye-bye.